Hello, and welcome to DermYoung's Untold Story of Skincare. I'm Nancy Griffin with Contento Marketing, and I'm pleased to be here to moderate this 6-part series where we interview experts on skincare topics of interest. If you like this webinar, please share on your social media channels, and please visit DermYoung's and subscribe to our YouTube channel. If you have any questions about this webinar or any particular questions for our panelists, please email customer_service@dermyoung.com. Today's topic is especially relevant in these times: how to prolong the effects of Botox in the social distancing area. Depending on the state you're in, it may have been weeks and weeks that you're having to go without your Botox, and that can be really hard. So today we have 2 amazing experts to help you navigate these waters. Our first panelist is Chrissy Thomas, RN, a master cosmetic injector and owner of About Face Skincare in Snellville, Georgia. We also have Sarina Elmariah, MD, PhD. She's a clinical advisor to DermYoung and board-certified dermatologist and assistant professor at Harvard Medical School. And finally, we have Yang Brooks, PhD, the founder and CEO of DermYoung. And Dr. Brooks is a former skin scientist at Massachusetts General Hospital and Harvard Medical School. So as you can see, we have some amazing talent here today to help you. So I'm going to get started. We have Chrissy Thomas, RN, who's from Georgia. And as you know, Georgia was one of the first states to open up. So before we get into the details of Botox, I'm going to ask you if you can give us an update on what's happening over there at About Face.
Yeah, so we are entering probably our first week at full service. We started the first week with just myself, adjusting our protocols, making sure that we were ready and had the proper protective gear to do our treatments, and then brought in the other registered nurse that works with me. And we just opened slowly. We were given the go-ahead to open, but wanted to take it slowly just to make sure that we could really properly care for our clients and make them feel safe, make sure we weren't tripping over any of our new regulations and ways of doing things here. So it's going very well. We are doing everything that we can do and improving those procedures every day. So we'll have some good feedback for others that are soon going to be opening. They won't have to make the same klutzy mistakes we've made with just trying to get ourselves set up. But as far as precautions and safety, we feel very secure in what we've been doing, and our clients have given us great feedback, and there's been no stall in business. It has been incredibly busy, so it's been a nice spinning 4 weeks.
Well, that's what I understand. Can you tell us what people are booking? What services?
Everything. We started with our Botox procedures, and I think a word of advice, if anybody is watching that is actually doing the treatments, it's easy to start with things that are very comfortable and quick like that. And then we started building on those procedures, getting back to doing some of our non-surgical facelifting and some of our other treatments like that. So we went a little slow getting back to full capacity. Clients want everything. They're ready to go.
And I know that About Face is a Black Diamond customer of Allergan, which means you're in the top 5%, I understand, right, of Botox use throughout the country. So can you tell us what some of the common uses are for botulinum toxin in your spa and how long the effects are expected to last?
We do a lot of the typical upper face treatments. We do a lot of forehead creases, frown lines, crow's feet, things like that. We do treat hyperhidrosis for the axillary area on a lot of clients. Typically in the facial treatments, we suggest people come back every 3 to 4 months. That's real important to make sure that we treat before the muscle is working to full capacity again if we want to get that extended, nice effective Botox. The Botox for armpit sweating usually will last about 6 months.
Great. Well, I know, Dr. Elmaria, that Botox is FDA approved as a safe and effective treatment for relaxing the muscles in the facial area. But it seems like I'm reading that it has different expiration dates on different individuals. So can you tell us a little bit about why this happens?
Yeah, I think what you're referring to is that Botox, after it's been injected into an individual, the purpose of Botox is to actually neutralize muscle activity. Okay, so that you have less of a impulse from the nerve to the muscle, and the muscle relaxes, and hence your wrinkles relax. So when you're referring to an expiration date, I think it simply is that it wears off differently in different individuals. Okay, so in the case of one individual who may have a lot of muscle, activity and a high kind of muscle tone, you may actually use up more of the Botox. It may be, even a larger number of units may be required to actually relax that wrinkle, and the effects may not last as long if they have a very prominent, wrinkle in that area, a lot of muscle tone. So, and that's one factor. Another factor that can limit the longevity of Botox is simply just how quickly your own body degrades, antibodies and medications and any number of things. That's true for really every product you use. So, some people get a little bit more shelf life out of filler, a little, other people get more of a shelf life out of Botox. And then the final thing is also even just the benefit, right, of how you train your own muscles when you undergo Botox. You learn to, in some ways, limit the use of those muscles to that area. So you actually reduce your muscle of facial expression, the strength of that. And so I think that can also prolong the effect of the Botox.
Well, you mentioned that the physiological effects of what happens when the Botox wears off. And if somebody is in a state right now where they're unable to make it in for some injections, what are some self-care tips you can offer that would help people until they can make an appointment?
Yeah, I think there are, and this is definitely going to also be, I think, Chrissy's wheelhouse and Young's wheelhouse, but there are many things that a person can do. The first is simply try to avoid using muscles of your muscles of facial expression. If you are aware that you're furrowing your brow, or you're frowning, or you're kind of wincing a little bit, try to relax your facial muscles, and that will actually help prolong the effect and reduce just simply the wrinkles. Many people feel that facial massage helps them relax their muscles. And then finally, just as a general skincare, in terms of hydration, reducing, excess, flaking or scaling, dryness, really does. Those types of efforts make a difference in the appearance and the youthfulness of your skin in general, and can actually, when your skin appears dry, it actually accentuates your wrinkles. So just doing, really important steps in your daily routine and skincare in general can help.
Well, Chrissy, I know that you are a big fan of DermYoung and that you use a lot of it in your spa. Oh, yeah. And I know that there's both things you do in the spa to help people prolong their Botox, other treatments, and then there's a home care regimen that you provide. So can you tell us a little bit about what you do at About Face for that?
Sure. In addition to intramuscular Botox, we do like to use Botox intradermally in a little device. I actually have one here. I meant to pull one for us, but it's little devices that we can actually put it inside the chamber and needle it into the skin. This particular one is called Aqua Gold. So we're able to put Botox in the chamber, as well as I love to use Dr. Brooks Youth Essence in here as well. And we microneedle that into the skin. And it really does make those pores tighter and make that skin appear even smoother. It's wonderful for people with breakouts and large pores. So that is something that's really popular to do in-house. And then we have another device like this. The needles are not quite as long. They're a 0.2 millimeter needle that is a take-home device. So things like this, derma rolling, I like to use those types of products and the derma roller with the Youth Essence and some of the other DermYoung products, just to really work it a little bit deeper into the skin and give the skin a nice glow. I find Youth Essence is probably It's my favorite product I've ever used, but I find that it really does help the skin look better. And I think it helps prolong the effects of better looking skin. I don't think you can necessarily prolong Botox. I agree with you that try not to lift this forehead and make those creases, or squint and make the little creases around the eyes, but using adequate skincare like the Retin-A and a nice quality vitamin C like Youth Essence and some proper hydration really helps a lot. And trying to reduce stress whenever we're home in times like this and you're worried about employment and worried about your children, just trying to relax a little bit, because the strain really does make creasing show a lot more.
Well, if we're not able to completely reduce our stress, at least we're allowed to take home some products that can help us through these times. So Dr. Brooks, can you tell us a little bit about why the Youth Essence particularly and DermYoung's products generally work so well to prolong Botox?
Sure. So first thing I want to say is the wrinkle formation is actually a multifactorial process. So besides the facial muscle movement, there are many, many other factors contributing to this process. So that's why, so many Botox users, find out Botox cannot really cover up all of their wrinkles, and then they have to get, keep getting a renewal every now and then. And what is not talked so much about is the fact that once a wrinkle is formed, there are actually fundamental changes to your skin structure around the wrinkle, which cannot be easily reversed by simply suppressing one contributing factor. So with that being said, Botox actually is very effective, and it gives the users actually protected time to do some fundamental repair work to fill up those existing furrows and creases to make their skin look more plump, so they can get less units next time or have a longer interval between their renewals. So speaking of why our products actually work so well, because we think about all the aspects of a wrinkle formation when we design the products. First, hydration. I mean, both Chrissy and Sarina already talked about. So humectants, emollients are important because you don't want your dehydrated skin to crease or to fold. That's one thing. And another thing is you really need to increase the cellular turnover. The skin around the wrinkles are actually much thinner than the normal skin. So, people like to use retinol, vitamin C, or AHA, BHA just to speed up the turnover, hopefully to, especially at the epidermal level, to make it thicker, and also to erase the dead cells accumulated on top of the wrinkles. That's another thing that we cover. We have a really effective vitamin C in our products. And the third thing is you have to have increased cellular capability to produce those lost collagen, the lost glycosaminog-glycan, the sugar components, the supportive dermal part, to plump up your skin to make the wrinkle go away. So that's something we cover as well. And then, as Sarina and Chrissy just said, the stress. You create so much cytokines, the chronic inflammation because of the stress, and then also the sunlight. You really have to suppress those inflammatory cytokines before they destroy your collagen and the elastin fibers. So we use really carefully selected and validated antioxidant for this process. And lastly, you have to use sunscreen. I think every dermatologist will agree that you have to use sunscreen if you want to protect your skin from wrinkles. That's the process that we cover in DermYoung products. So the Youth Essence specifically not only are designed to increase your cell turnover, your cellular activity to produce those dermal support substance, and also hyaluronic acid in your epidermal layers as well. To repair the wrinkles and also normalize your cell's activity as preventative, and also to repair your skin inside out.
So it sounds like DermYoung is actually for skin wellness as well as appearance. So it's actually healing the skin, which of course it makes sense that it would make the skin look better for longer, no matter what treatment you're doing. So yeah.
Yeah, I would like to share you a quick photo that Chrissy sent me a while back. It's actually Chrissy's customer. And when she sent this to me, she said she thought the customer was cheating on her. You ladies see the screen?
Yeah.
Yes.
Yeah, Chrissy,
Wow.
this is your photo. Would you like to say something about that?
So I have known this client for years. We've been together since probably 2003. And she has had some other treatments done, some other surgical interventions. And so has always had a nice appearance. She was 76 years old at the time of this picture. And so she came in to see me, and she participates in our non-surgical facelifting program. So we see her pretty regularly, but I don't do those particular treatments. So when she came back for her next Botox treatment, I said, oh my gosh, what have you done? And she said, well, I don't know, just using those products you gave me that cute doctor told me about when she was here, because she had been to the Aging Naturally seminar that we had. And that was a 6-month difference there. And I was so excited to capture that, because I see it all the time and using the DermYoung product line, but to actually capture it in someone who had done very little she had done nothing else new and very few other things to her skin. That was pretty remarkable.
That's great.
That's something.
Yeah, for a 76-year-old.
Yes. Yeah.
Amazing.
Yes. She was very excited.
So, Dr. Elmaria, do you have any final words about this particular topic?
In general, I think we've covered everything. I really want to underscore the importance of keeping up with a regimen. Definitely, as Young pointed out, it is critical that you wear sunscreen. If you're going to go to the effort to do Botox and to use a regimen, whatever that may be, making sure you stay on top of your sunscreen. But I can't emphasize that enough. But I think, in general, having people that you trust, that you go to, that you can discuss, what's the best regimen for you is also another, I think another really important resource. And so I encourage everybody to ask questions and find what is the best, option for themselves. And thank you for doing that.
Thank you. And how about you, Chrissy? Any final words?
A couple of things I did want to mention. People ask me often about what my thoughts on people starting early. We're seeing the initial age for starting Botox treatments push back a little bit earlier over time. And I do think it's important to start treating your skin using adequate medical grade skincare, nice skincare products, and maybe even tweaking with Botox before you start seeing very obvious creases, because once those creases are pleated in the skin, it is harder to turn back and see that smooth canvas again. So I think it's nice to go ahead and get started when you start seeing changes that you don't like. The second thing I wanted to mention, we covered sun care, which was very important aspect, and general skincare. But I am amazed at how many people don't wash their face before they go to bed at night. And that's something I wanted to mention. That's very important, that you do cleanse the skin thoroughly, even if you don't put makeup on in a day, and even if you don't wear sunscreen like we're telling you to. It's very important to go to bed with clean skin, hopefully with some nice products that we've been talking about on your skin, so that you are treating your skin while you're sleeping at night. But certainly important to wash.
Well, I'm going to hand it over to Dr. Brooks for final words, but I wanted to mention the sleeping, washing your face and sleeping, that vibrant boosting mask to wear overnight is amazing.
It's amazing.
Dr. Brooks, do you have any final words?
Oh yeah, just to follow Chrissy and Nancy. So for people with neck wrinkles, they do some Botox or like radio frequency for the neck wrinkles. They are welcome to try the vibrancy mask with a youth essence on their neck. They will be surprised, because the neck wrinkles are one type of very, very stubborn wrinkles. So they're welcome to try. And next time when you get Botox, if you, no matter you are in Chrissy spa or some other spas we partner with, please pick up a youth essence to go with your Botox. That will truly make it last longer.
Yes, and you can, of course, find the products at DermYoung.com, or Chrissy sells them, obviously, at her med spa, and you have specials often. So DermYoung never discounts their products out of respect for their partners. So either one of those places is a great place to find DermYoung products. And good luck out there. Hopefully your med spas and your dermatology clinics will be opening soon and you can go get your Botox. But in the meantime, we're here to help. Thank you.
Thank you.
Thank you. Take care.